First off, I want to, before I get going on this discussion, I want you to understand how incredibly important it is that as we talk about adverse childhood experiences and talk about the effects that they have on us as individuals and also on society in general, that we don't get into the mode of judging parents. If there's one thing I think is hurtful is to have somebody walk away from a discussion on this and say, man, my parents were horrible. And my experience doing this is in the jail setting mostly, dealing with inmates who have lots of times, there's 10 ACEs that they talk about in the Adverse Childhood Experiences study, and many of them have 7, 8, 9, or 10 of those ACEs. And what I always talk about to them is this is not about being angry at your parents. This is understanding that guess what? Your parents probably had their own problems and struggles when they were kids too, and they're doing the best they can for the most part. And that's kind of what I try to help people understand is that most parents I know, wherever they are, they want to be good parents. And it's a natural thing to want to do that. And I think it's just important to understand that. So as we go forward, always keep that kind of in mind. The human brain to me is just one of the most complicated, amazing structures that you can even think of. It just kind of every time I think about the brain and what it does and how it adapts to environment and stuff like that, it just makes me wonder, how does it do it? How does it keep doing it and do it pretty well most of the time? Inside our brains, about 100 billion, neurons. Okay, and each neuron, all those 100 billion neurons are there by the time of 6 months of gestation. Okay, but yet if you look at the little picture right here, you'll see that the brain of a child when it's born, an infant, is pretty small, but during the first 2 years, that brain grows to 75% of its adult size. Well, where does all that volume come from? Where does that increase in volume come from? It comes from new synaptic connections and branches coming off of those 100 billion neurons, okay? And over those first 3 years of life, each of those 100 billion neurons makes 10,000 lateral connections. Now think of a forest with 100 billion trees in it, spreading across the United States, and each tree has 10,000 branches that might connect with some tree in Arkansas or a tree in Alaska or a tree up in Canada or someplace like that. Think how incredibly complicated that is. And what guides the formation of those new branches, those new connections, is experience. What a child experiences during those first 3 to 4 or 5 years is incredibly important in my estimate, just from reading this, the science on it, trying to understand it. The connections are made at about 10 million new connections per second. Okay, and again, which connections are made and which connections are reinforced and which connections die away kind of depend on our experiences and what happens as we grow up. This is kind of an artistic view of neurons. I don't know. I've looked under microscopes at brain tissue before, and I can't really see all this when I look at the microscope. It's just kind of this blah stuff, but it's because you're cutting through all sorts of neurons, you can't really see them that well. But this is kind of a picture of what they might look like on a microscopic level. And what I've done here is I've got 3 little vignettes from Harvard University's Center on the Developing Child that I think are pretty important to understand how the brain grows and develops as we discuss adverse childhood experiences and how they might affect the whole process. So I'm going to start with this and we'll see how this works. It's amazing it works.
A child's experiences during the earliest years of life have a lasting impact on the architecture of the developing brain. Genes provide the basic blueprint, but experiences shape the process that determines whether a child's brain will provide a strong or weak foundation for all future learning, behavior, and health. During this important period of brain development, billions of brain cells called neurons send electrical signals to communicate with each other. These connections form circuits that become the basic foundation of brain architecture. Circuits and connections proliferate at a rapid pace and are reinforced through repeated use. Our experiences and environment dictate which circuits and connections get more use. Connections that are used more grow stronger and more permanent. Meanwhile, connections that are used less fade away through a normal process called pruning. Well-used circuits create lightning-fast pathways for neural signals to travel across regions of the brain. Simple circuits form first, providing a foundation for more complex circuits to build on later. Through this process, neurons form strong circuits and connections for emotions, motor skills, behavioral control, logic, language, and memory during the early critical period of development. With repeated use, these circuits become more efficient and connect to other areas of the brain more rapidly. While they originate in specific areas of the brain, the circuits are interconnected. You can't have one type of skill without the others to support it. Like building a house, everything is connected, and what comes first forms a foundation for all that comes later.
Okay, I'm going to go to, so here again we have sort of an artistic drawing of what we're talking about. Newborn neurons don't have a whole bunch of connections. You look at a little baby looking at you in the eyes when they're first born, they really can't, they don't like look at you that much, but as they start to continue to look at you and you look at them and you start to talk to them and Google and Bob, they start to look at you again. They start to grow all these new lateral connections that go off to the other neurons and make all these important circuits. During the sensitive periods during early brain development, these are kind of different lines. The purple lines, emotion control, habitual ways of responding to things, symbols. The black lines are numbers, pure social skills. The red lines, symbols. All these lines, if you notice where the really sensitive areas are, they're like 0 to like 3 or 4 years of age. So by the time a child hits kindergarten, they're already kind of down the pathway towards wherever they're going to head. And I bet we've had some school teachers and maybe elementary school teachers in the audience who will tell me that, yeah, that is, we're trying to fix problems that have already started long before the kid shows up at kindergarten, okay, if there's problems happening. We're going to talk about it a little later on. This is the second video from the Harvard series on the early development issues. I'm going to just, hang on, come back here. There you go. Do you want me to shut the lights off? Is that better? Because I have to shut all the lights off. It's going to be dark.
The key to forming strong brain architecture is what's known as serve and return interaction with adults. In this developmental game, new neural connections form in the brain as young children instinctively serve through babbling, facial expressions, and gestures. And adults return the serve, responding in a very directed, meaningful way. It starts very early in life when a baby coos and the adult interacts and directs the baby's attention to a face or hand. This interaction forms the foundation of brain architecture upon which all future development will be built. It helps create neural connections between all the different areas of the brain, building the emotional and cognitive skills children need in life. For example, here's how it works for literacy and language skills. When the baby sees an object, the adult says its name. This makes connections in the baby's brain between particular sounds and their corresponding objects. Later, adults show young children that those objects and sounds can also be represented by marks on a page. With continued support from adults, children then learn how to decipher writing and eventually to write themselves. Each stage builds on what came before. Ensuring that children have adult caregivers who consistently engage in serve and return interaction, beginning in infancy, builds a foundation in the brain for all the learning, behavior, and health that follow.
And I got number 3 here. These are all kind of important. To me, this helps me understand a lot better.
Learning to deal with stress is an important part of healthy development. When experiencing stress, the stress response system is activated. The body and brain go on alert. There's an adrenaline rush, increased heart rate, and an increase in stress hormone levels. When the stress is relieved after a short time, or a young child receives support from caring adults, the stress response winds down and the body quickly returns to normal. In severe situations, such as ongoing abuse and neglect, where there is no caring adult to act as a buffer against the stress response stays activated. Even when there is no apparent physical harm, the extended absence of response from adults can activate the stress response system. Constant activation of the stress response overloads developing systems, with serious lifelong consequences for the child. This is known as toxic stress. Over time, this results in a stress response system set permanently on high alert. In the areas of the brain dedicated to learning and reasoning, the neural connections that comprise brain architecture are weaker and fewer in number. Science shows that the prolonged activation of stress hormones in early childhood can actually reduce neural connections in these important areas of the brain at just the time when they should be growing new ones. Toxic stress can be avoided if we ensure that the environments in which children grow and develop are nurturing, stable, and engaging.
Okay, now this is the fourth one. I got a whole bunch of these. I hope it's okay, because to me this is Harvard does a better job than I do explaining this stuff. I can tell you that right now. This is about neglect, and it's just, oops, hang on just a second, wrong one. Okay, here we go.
Everyone in a community has a vested interest in everyone else's children, because everyone else's children determine the next adult population that makes for a successful society. Built into our biology is the need to have responsive interactions with adults.
Neglect for children is when they don't get what the brain is expecting to get, what the child is expecting to get, what we are biologically prepared and waiting for, which is input from those around us.
It's this back and forth serve and return interaction that literally shapes the architecture of the brain.
Serve and return begins when a child looks at something or observes something, makes an utterance, and that represents the serve. And the return is when the parent notices the child doing these things and responds to the child.
Under conditions where serve and return is broken, you literally are pulling away what is the essential ingredient of the development of human brain architecture.
It was a really compelling series of experiments where they started by videotaping the mother and the baby engaging in cooing and smiling.
And then they asked the mother to basically put on a blank face and not respond. When a baby is not attended to, that is a sign of danger to the baby biologically. So the stress systems become activated.
In a brain that is constantly bathed in stress hormones, not as up and down that comes with normal development, certain key synapses, the connections between nerves, fail to form, and critical regions of the brain.
So neglect both fails to provide the stimulation that's needed to develop the basic architecture, and when it's at a certain level, is one of the most potent activators of the stress biology of a young child. So you get the double whammy.
Science points to 4 categories of this spectrum of neglect. The first category would be what's called occasional inattention, when children experience responsiveness most of the time, but occasionally adults don't respond. There's no harm in that, and in fact, there's probably some benefit.
A child can learn to self-soothe and explore the environment, and all of those opportunities build brain architecture.
The second category, scientists would call chronic understimulation, is where on a regular basis, children have less interaction with the adults around them than is needed for healthy development.
Those children typically, when provided with enriched learning opportunities and more typical levels of serve and return, will show catch-up.
The third category is what science would call severe neglect in a family where not only are there prolonged periods of inattention and lack of responsiveness, but often also associated with not being fed enough, not being bathed enough, not having basic needs met.
Neglect is a huge problem in the U.S. children are much more likely to be neglected than they are to experience any other kind of maltreatment.
We see the child really being at risk for much more substantial kinds of deficits down the road that don't necessarily get easily fixed or ameliorated. This is where we really need to think about more complicated and often more intensive strategies to help undo those effects.
The fourth category, called severe neglect, generally found in institutional settings, is the result of children living in kind of warehouse type situation in orphanages.
And it doesn't have to even be as extreme as orphanages. It can be experiences that are regretfully occurring in many, many parts of our country.
Often institutional care in this country is under the euphemistic name of transitional care or temporary care or assessment facilities.
If you think about what institutional or residential care would look like for an infant, where there's somebody new coming onto the shift every 8 hours, it really alters the development of the child's brain architecture and other aspects of the child's development.
We have the potential to change children's developmental trajectories.
Interventions can apply to parents, to foster parents or adoptive parents, child care settings, Head Start settings, and other kinds of settings. And really, what they're about is attuning people to the serve and return process.
Neglecting young children is neglecting the foundations of a healthy next generation. The community pays a huge price later in terms of the problems of the next generation, whether it be educational achievement, economic productivity, good citizenship, the ability to parent the next generation. All of the things that have to do with a healthy, prosperous society.
Okay, I got one more. Now, this is important. This is a 5-minute version of the resilience movie that lasts an hour and 10 minutes about. And the reason why this is important is it kind of introduces the whole concept of adverse childhood experiences. We just talked about how the brain gets wired. We talked about how serve and return interactions between adults and children are extremely important. We talked about what happens with neglect, which is one form of ACEs, but there's lots of other ACEs out there besides neglect. Certainly neglect is probably one of the most prevalent things that happens because guess what? Kids don't remember being neglected. So when you ask an adult if they were neglected, they may not exactly remember what happened when they were 2 years old or 3 years old. In fact, most of us don't. So I think it's important to understand that neglect really probably is one of the most common ones that happens, and it's probably, has a lot of effects. I'm going to go ahead and play this one. This is another 5 minute. I think these are important for you guys to just kind of get a baseline.
What does your parents' divorce have to do with your risk for heart disease? If your mother had a drinking problem when you were growing up, are you more likely to suffer from depression as an adult? Here's what you should know about ACEs. ACEs stand for Adverse Childhood Experiences, extremely stressful events that can happen to a child growing up. Some experiences are so stressful that they can alter brain development, as well as the immune system, increasing the risk of lifelong health and social problems in adulthood. The term comes from the Adverse Childhood Experiences Study, landmark research that shed new light on the root cause of everything from stroke and liver disease to substance abuse and mental illness. In the late 1990s, an epidemiologist from the Centers for Disease Control and a preventive medicine doctor at Kaiser Permanente set out to understand the association between childhood experience and lifelong health. They asked over 17,000 people in the Kaiser Health Plan in San Diego about their health history, as well as difficult questions about their experiences growing up. Anda and Felitti tallied up 10 different kinds of adversity in this largely middle-class and college-educated population. They were stunned to see how common ACEs were. 21% of all respondents were sexually abused as children. 19% grew up with someone who suffered mental illness. 28% had been physically abused. And 2 out of 3 respondents had experienced at least one ACE. The researchers next looked at how someone's ACE score, or the number of adversities they experienced, related to a wide array of serious health and social problems. They saw that the more ACEs someone had, the greater their risk for poor outcomes compared with someone with no ACEs. Someone with an ACE score of 4 had twice the risk of heart disease and cancer. Someone with an ACE score of 5 had an 8 times greater chance of being an alcoholic. And those with an ACE score of 6 or more, on average, died 20 years earlier. With every major problem they looked at in the ACE study, the risk went up for each additional adverse experience in childhood. As Dr. Robert Anda says, what's predictable is preventable. It's important to remember that ACEs are not destiny. ACEs are a tool for understanding the health of a population as a whole. For individuals, an ACE score can be a tool for understanding their own risk for health and social problems, and empower them to make changes for themselves and their children. ACEs tend to get passed down from generation to generation and are common across all income levels, races, and cultures. But increasingly, people of all different professions and backgrounds are coming together to discuss how ACEs affect their communities. They're finding new ways to treat and prevent ACEs. Many doctors are starting to screen their patients for ACEs as part of their medical history. More schools are becoming trauma-informed, considering the source of problem behavior when disciplining their students, instead of immediately suspending or expelling them. To learn more about interrupting the cycle of adversity and improving health and well-being for the next generation, please visit kpjrfilms.co.
Okay, so this was published in 1999 or 1998, somewhere back in those days. And I didn't hear about this whole issue of ACEs and adverse childhood experiences and trauma issues until about, 7 years ago or something like that. CAPS had put on a half-day seminar on brain development and adversity. And I'd never even thought about this or heard about this until that day. And I remember sitting through that half day and saying, wow, this is really impressive. I never knew this. And I remember before that time, I was working in the Cache County Jail taking care of inmates and just mostly being angry at them and frustrated with them. And quite honestly, sometimes chewing them out and being pretty negative with them. And after seeing that and after understanding this study and getting more information on this, I've kind of changed my viewpoint about how that all works. And when I see people in jail that I've seen come through the jail and they come in for substance use disorder problems with meth or alcohol or DUIs or whatever, they come out of jail and they come back in 3 months later and I see them again and again and again. Instead of being angry at them, I actually have a little bit more ability to talk to them and help them out a little bit and help them understand why they keep having problems. And it's been amazing to me over the last couple of years that I think the inmates actually respond to understanding this concept. They actually start to think about, why am I doing this? And what do I do to make a difference? So the ACEs study basically asks 10 questions. And I want you to silently ask yourself, because it turns out most of us had ACEs, like probably 2/3 to 3/4 have had ACEs. I want you to think back to your own childhood and also think about people you might work with, maybe kids you're working with, maybe adults you're working with that may have some ACEs. The first 3 questions have to do with abuse: physical abuse, emotional abuse, and sexual abuse. Okay? And these are the questions that they actually asked in that survey of that 17,000 adults that were mostly college educated, employed people, not people at the Cache County Jail necessarily, right? And then you got the fourth and the fifth question are about neglect. And they asked the question about, did you feel no one in your family loved you or thought you were important, or your family don't look out for each other? Well, that's kind of a vague question. And I don't think the question is the best they could do, but think maybe they didn't capture everybody that really was neglected. Because guess what? Most of us don't remember that, right? And then number 5 is physical neglect, that you often feel you didn't have to eat, dirty clothes, or your parents were too drunk or high to take care of you, or take you to the doctor if you needed it. So those are the kind of questions they asked for the first 3 is physical abuse. Fourth and fifth questions are about emotional and physical neglect. And then the next 5 questions are about household dysfunction. And were your parents ever separated or divorced? Was your mother or stepmother often pushed, grabbed, slapped, sometimes kicked, bitten, repeatedly hit? Did you live with anybody who had a problem with substance use, alcohol, or drugs? Was a household member depressed or mentally ill, or did a household member attempt suicide? Did a household member go to prison? If I were doing this study again, I would go up here to this one right here and ask about being separated from your parents for other reasons besides divorce or separation, because a lot of my inmates, their parents died from suicide or got shot in a gun battle or something like that. It's not just separation or divorce. And some of the inmates I take care of tell me about being in the house the time their parent took their own life when they were 10 years old or 5 years old, and walking in the room and seeing that whole thing. So think about how those kinds of things might adversely affect a child's developing brain and their ability to deal with stress. We have this thing inside our brain called an amygdala, which alerts us when something bad's going to happen or something bad might happen. So like if you're driving down the street and somebody jumps out in front of you, like your amygdala goes, wah, bang, 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 you got to do something quick, right? So it's this rapid response system to try and get you out of danger or prevent you from causing problems. I remember I was driving down the freeway, zoned out, going to Salt Lake, and what happened was I had, I almost ruined a car. And I remember, bam, all of a sudden my heart rate was 140, and my eyes were dilated, and everything got really bright, and I was sitting there shaking and all this kind of stuff. Well, that's all the amygdala doing its thing, right? Well, some people who have overactivation of their amygdala all the time experience that all the time, or some form of that all the time. And to me, it's like when somebody says they're anxious, it's just amazing to me. I don't think I understand exactly what they're talking about. When somebody tells me they're anxious, I'm not sure I understand that, because I don't think I've experienced what they're experiencing. But anyway, let's go on to the next question. So these things kind of happen, and this is a questionnaire to 17,000 people. And again, as mentioned in the little movie there, only about 1/3 of us didn't have any ACEs, and 2/3 of us had at least one, and about 1 out of 8 of us had 4 or more ACEs in our life growing up. This is kind of prevalence of adverse childhood experiences by the type of abuse. You've got 11% of the psychological abuse, physical abuse, sexual abuse, all these different numbers. It's important to understand that a lot of these things overlap, like when you have 2, like if you have one of these things, you're more likely to have some of the other ones too. I'm going to first talk about ACEs and mental health effect, because I think a lot of the troubles I see in people with mental health challenges that have ACEs is this fight, flight, or freeze thing, and they're always wired for anxiety and just things, something bad's going to happen. And they tell me the same thing. It's amazing. If somebody tells me, if they come to my office or I see them in the jail and they tell me, Dr. Red, I can't sleep, Dr. Red, I'm anxious, my mind's racing all the time, or I'm medicating myself with alcohol or methamphetamine or marijuana or whatever they're using to medicate themselves, I go back and ask them the ACEs question. I don't ask them the ACEs questions. I just tell me about what happened when you were a kid. I just kind of leave it open-ended, because I'm not trying to collect data for a research project. I want what comes to their mind when they have this problem, and they tell me all this stuff. And I said, wow. Well, guess what? You're wired for fight, flight, and freeze. Your brain, during the part of its development that was so important, got wired to survive in a very difficult, challenging circumstance. And I think that's important for them to understand. But what the ACEs study showed, and other studies since then have shown that as your ACE score goes up, your weeks of depression in the last year go up. Okay? As your ACE score goes up, your probability of being prescribed an antidepressant medication by a physician or nurse practitioner or PA goes up. your panic reactions go up. And people tell me about spontaneous things that happen to them. They all of a sudden just get overwhelmed and have rapid heart rate and chest pain, and they can't breathe, and they don't have any idea what triggers it. And I say, wow, what is that about? It's never happened to me. I got panicked this morning when I couldn't find this little thing I was supposed to hook this computer to this. It turned out okay, but I've never had that experience where I've had a panic attack, and I don't know what that means. And when people tell me I have a panic attack, I'm pretty sure, I've talked to so many people that had them, I'm pretty sure I have no clue what they experience. Hallucinations and ACE scores. I've got all these patients that have a diagnosis of schizophrenia, but they don't look like they have schizophrenia. They take care of themselves, they take showers and baths, and they live in their own home, and they're doing okay, but they're still hearing voices sometimes. But they recognize them, they have some insight that the voices are not real, but they still hear the voices. And I say, guess what? I sit down and ask them the ACEs question. Man, they have an ACE score of 8 or 9 or 10, most of them. So you have this group of people that get labeled with schizophrenia or schizoaffective disorder, and they don't necessarily, I don't know if they really have that. I kind of think they have, I call it complex post-traumatic stress disorder or developmental trauma disorder, whatever you want to call it, but it's just not quite the same as schizophrenia, which to me is just like, God, how does this work? So this is the ACEs go up, your chances of having hallucinations go up. Emotional dysregulation. A lot of people have this problem, and they always say, oh, you need to go get anger management training. You need to get anger management therapy or whatever the deal is. You need to go talk to somebody and help control your anger. Well, people that have a over-exercised amygdala and have a hippocampus that's not very big because of trauma issues sometimes have a really hard time controlling flying off the handle, so to speak, or snapping. They talk about snapping and then having blackouts and hitting somebody and doing stuff like that. Anyway, ACE scores as a kid, risk of perpetrating domestic violence, that's kind of the emotional dysregulation stuff. This is sort of a big slide that has a lot of information, but this is the odds ratio. Now, odds ratio just means if you have an ACE score of 0, your likelihood of having something is 1. So if your ACE score is 4+, in the case of high perceived stress, the odds ratio of having that problem adjusting for everything else is about 2.2. Well, this is difficulty controlling anger. I see this all the time in inmates. They get in jail because they get into a fight with somebody or assault somebody or beat up a police officer or something happens to them. And I ask them, hey, tell me what happened when you were a kid. And it's not uncommon to get this really horrendous story about people that did not have much of a nurturing effect from their adult interactions during their growing up years. It's just not uncommon at all. In fact, it's most of the time, it doesn't surprise me a bit. The risk of perpetrating intimate partner violence is this in people with an ACE score of 0, this happens in 1.6%. But if you have an ACE score of 4+, you're 5.5 times more likely to be involved in that kind of a problem. So hence we have services in the community to try and address this. We've got CAPS and things like that to try and deal with intimate partner violence and things like that. Impairment of childhood memories. This is something that I'm not a neurobiologist or anything like that. I'm just a primary care doctor. But if you have problems with high levels of stress and high levels of cortisol and high levels of adrenaline, and you're activating that amygdala all the time, your hippocampus doesn't get exercised much, and actually on X-ray images of the brain and functional MRI things on the brain show that the hippocampus, where the memories are kind of stored, as part of the memory function, it kind of gets shrunken down and atrophied. And people have lots of adverse childhood experiences. And so guess what? They can't remember much that happened in their childhood. And sometimes people tell me that. I don't remember much. I don't remember what happened. And if you talk about people when they're having, even with PTSD, sometimes people when they have a major trauma in their life, they can't tell you specifics about that whole issue because their amygdala is activated, and the hippocampus, it's a priority to survive right then, not keep track of all the little details that are going on, right? So it's like they sometimes have trouble with remembering things that happened when they were kids. So guess what? When we ask them questions as adults about what happened when you were a kid, we're going to get sort of a biased result. So the ACEs study all by itself kind of gives us an underrepresentation of what really happened if you ask all these ACEs questions. We got unexplained panic attacks. We already talked about that. Depressed mood. And again, as your ACE score goes from 0 to 4+, your relative odds of having something happen go way up on all these things. Anxiety, hallucinations, sleep disturbances. I can't tell you how many people I talk to in jail who tell me they have a really hard time sleeping. They have emotional dysregulation, they have anxiety, and they can't sleep. And it didn't happen just because they're in jail. It happened way before they're in jail. And guess what they do? They medicate themselves with stuff to help them sleep, whether it's cannabis or alcohol, even methamphetamine. I never, it's really strange. I have all these people that tell me they use meth to calm their brain down. I says, holy smokes, what are you experiencing? What is your brain like when you're not on meth? They actually use it to calm their brain down. It helps them relax. I said, oh, man. I just don't understand. I'm just telling you. Okay? All right. Okay, now this is some more mental health stuff. On the blue box, the gray box is the percentage of people in the ACEs study that had an ACE score of 0 versus the percentage that had an ACE score of 7+. So 1% of the people, of the 17,000 people, had an ACE score, or 1% of them had an ACE score of 7+, and 36% of them had an ACE score of 0, and this is kind of what happens as your ACE score goes up. You know, there's fewer people that have that much adversity in their childhood, but look what happens to their lifetime history of attempted suicide. If your ACE score is 0, you have a 1% likelihood of having attempted suicide during your life. If your ACE score is 7+, you have a 35% chance of having attempted suicide during your life. Okay? Well, think about that. Okay, that's for adults. Let's go to youth. This is the odds ratio of a child or an adolescent having attempted suicide during their adolescent years. Meaning if you have an ACE score of 0, your odds of having done that is 1. If you have an ACE score of 7+, you have a 50 times higher likelihood of trying to have taken your life by the time you reach 18 years of age. And so when we're talking about childhood suicide or childhood suicide attempts or childhood depression, we're talking about stuff way downstream, I think. I think we're talking about things, that's the end result of a whole bunch of other stuff that we failed to recognize or failed to address or failed to fix. So let's go on to the second part, ACEs and substance use disorder. So, and again, as I talked about this, most people that have substance use disorder, in my experience, where they're really having a hard time with it, not all of them, but a lot of them have a bunch of trauma they're trying to medicate. That's just my biased opinion from working in the jail. Maybe my, I don't know, this is my, I've talked to all these people who have all these substance use disorder problems, and they tell me a lot of the same things. They, you know, if you ask them about their childhood experiences, they tell me a lot of the same stuff. This is from ANDA, from the Centers for Disease Control and Prevention. If you look at the ACE score of 0 through 4+, and early smoking initiation, you see a graded response to that. Current smoking, the same issue, and of course the outcome, the long-term outcome of smoking is chronic obstructive pulmonary disease or problems with breathing related to smoking. Now ask yourself, why do people smoke and why would they self-medicate with cigarettes? Well, I ask them this question all the time, and I get the same answer. It helps me relax, okay? It helps me calm down. And so if you're dealing with somebody who's got ACEs, and you're going to tell them to stop smoking, and all you do is say, you got to stop smoking. That's the only intervention you got is, you got to stop smoking, Joe. It's going to ruin your lungs, it's going to ruin your health, blah, blah, blah. But you don't deal with the real problem, which is, okay, I've got all this agitation in my mind, racing thoughts at nighttime, anxiety all the time. I can't shut it off, and when I smoke a cigarette, it really helps. They're using it as a medication, okay? They're not using this just because they think it's cool, okay? They're using it because it helps them calm down and relax. And I've seen this numerous times. Same with alcohol is kind of the same problem. And alcohol can cross over into other types of mental health problems like bipolar disorder. Sometimes people use that to medicate themselves, but a lot of people with ACEs are going to use this based on our ACEs study and graded response to ACEs versus alcohol use. It's one of those issues, okay? So the more likely you have, the more ACEs you have, the more likely you are to use alcohol. And guess what? You're probably trying to calm those feelings or emotions you're having inside your head because of an overactive, stress response that's chronically activated, and you just have to try and deal with it the best you can. Illicit drug use versus ACE score. This is a little complicated slide. This is initiation of drug use. In the blue lines are people that start using drugs before the age of 15. And you'll notice this is very low for people that have ACE scores of 0. If you've got 5 or more, you're 10% of people are using drugs before they're 15. Okay? And the same thing with lifetime illicit drug use goes up in a graded response based on the ACE score. This is kind of another summary thing right here of the odds ratio. The previous slide showed the actual incidence. This is odds ratios. And this is 6.5% smoking. If people have ACE score of 0, 6.5% of them smoke. People have an ACE score of 0, 2.5% of them consider themselves to have an alcohol problem. and 8% of people who have an ACE score of 0 have illicit drug use. But if you have an ACE score of 4, your rate of illicit drug use, alcoholism, smoking all go up. And this is ever injected drugs odd ratios. If you got ACE score 0, you got an odds ratio of injecting drugs in 1. It goes up tenfold if you got ACE score 4. Again, people using IV drugs, in my mind, are doing it to try and, they don't know what else to do. Again, I've talked to hundreds of inmates that have this problem, and people out in the community too. It's not just in the jail where I work. ACEs and physical health outcomes. What are the long-term effects of chronic activation of this high level of adrenaline, cortisol, and this hypothalamic pituitary adrenal axis thing? What I see in people that have lots of ACEs is typically they have high blood pressure. Typically they have a rapid heart rate, resting heart rate that's kind of high. And typically they have all this anxiety stuff going on, but let's see what the studies show. So if you have an ACE score of 4+, your chance of having a stroke, which is related to blood pressure and stuff like that, and your chances of having chronic bronchitis or emphysema, your chance of having diabetes, they all go up, okay? Your life expectancy is cut by 20 years if you have 6+ ACEs, meaning that a life expectancy for a male, I think, is 78 or 80 years old or something like that. They're going to die 20 years earlier if they have 6+ ACEs on average. And it's not because it's not all from suicide. It's from all these chronic health problems that they have. If you have somebody that has a whole bunch of health problems, not always, but sometimes they have a whole bunch of ACEs too. Effects of ACEs on the developing brain and resultant short and long-term outcomes. Again, we showed this slide earlier about the sensitive time of development. When a child's in 0 to 4 years of age, you got all this stuff that's supposed to be developing and all these synaptic connections that need to be made. They're made by experiences that people have, little kids have with their parents and other adults in their environment, and also their siblings and kids. But really, they got to have some of these experiences to develop these synapses. This is a really interesting study looking at the sizes of brains in people with severe extreme neglect, and we're talking about probably people in orphanages type of neglect. And kids that are raised in orphanages sometimes come out of that with this thing called reactive attachment disorder, which is one of the most difficult, almost impossible things to treat that I've ever seen in my life. It's just, I don't know, it's just really hard. But anyway, so this is a normal-sized brain of a 3-year-old child that had normal environment, and normal stimulation, and normal interaction with adults. And this is kind of this little other brain that's kind of shrunken down and atrophied on the cortex, and the ventricles are bigger. And they did this on a bunch of different children. This wasn't just one child. They did it on hundreds of kids and found the same thing. The other thing they found out is if they took these frontal occipital circumference measurements, they basically measured the circumference of this head, and they took the child and put him in a nurturing environment within 1 year. If they did this when they were 1 year of age, within 1 year, their brain size had increased from the 5th percentile to the 26th or 27th percentile, which is kind of cool, right? If you take a little 1-year-old and you find out that if you give them some support or help them get the nurturing they need when they're not getting it, you can help their brain actually grow in size, because guess what? They're forming all those lateral branches I'm talking about that takes up more room, right? So this happens. They've done these studies looking at the brain sizes of kids as they get taken out and removed from this neglectful or non-stimulating environment. Well, look what happens when you're up to age 5. When you're up to age 5, taking them out of the environment doesn't make that much difference anymore. I mean, that's kind of it's just overwhelming to me. As far as children with developmental delays, the more risk factors they have for adversity issues, the more troubles they have with developmental delays and impairment. This is a really interesting study done by Nadine Burke now. Nadine Burke's, she works down in San Francisco. She's a pediatrician, and she's been involved in this whole ACEs issue for quite a long time. But she basically looked at a lot of kids coming into her clinic in her neighborhood, which are mostly more lower income and kids from adverse backgrounds. And for children that had an ACE score of 0, what she noticed is that there was no learning and behavioral problems in 97% of those kids, and only 3% of them had troubles with learning or behavior problems in school. But if they have an ACE score of 4+, it's up to 51% from 3%. Okay? Well, that's the odds ratio, the calculated adjusted odds ratio was 32. So you got ACE score of 4+, you got a 32 times more likelihood of having troubles with learning and behavior issues in school. So all you school teachers out here that are dealing with this problem, I mean, this is what you're dealing with. You're dealing with situations where kids didn't have what they needed necessarily in the first 3 years or 4 years of their life. And now they show up in your classroom, you got these problems. And this study to me was just really compelling about how important it is to try and improve outcomes by going way upstream and not just wait until they get to school to try and fix them. This is high school non-completion rates in ACE scores, unemployment in ACE scores, okay, and household poverty as adult in ACE scores. And you can see that the adjusted odds ratios, they go up for every year. You've got a lot of ACEs, you're going to have more troubles with dropping out of school, not completing high school. You have more problems with unemployment, household poverty. This is workplace performance data. Absenteeism greater than 2 days per month, serious financial problems, serious job problems. As your ACE score goes up, you have more problems. Well, what does that mean? Well, it means if we're going to have a healthy society or community, we got to try and do the best job we can to try and help people and parents and families do the best job they can, in my mind, in giving kids a nurturing childhood. Now, this is income as adults versus ACEs as a child, and this is just a really interesting graph to me. If your ACE score is 0, the slope of this thing looks like this. If your ACE score is 4+, it goes down like this, which kind of shows that if you have lots of ACEs, your chances of having a higher income during your life is lower. That's kind of, it's kind of ties in with all the other data we've already looked at. This is a slide that got stuck in the wrong place in the presentation. Anyway, this is supposed to go back to the physical stuff. We got the sleep disturbances and severe obesity and multiple somatic complaints. This is supposed to be up with the physical complaints, so I'm sorry about this, but I want to talk about this for a second. The multiple somatic complaints part, when people have chronically elevated or escalated adrenal pituitary axes, they're just hyper functioning. They have higher cortisol levels that wears your body, that basically helps your body wear out faster. It's a stress hormone, it helps your body wear out faster. And most people that have ACEs, and they're kind of up in their 40s and 50s and 60s, I've got a lot of patients in my practice they're in that situation. Most of them have some other physical problems they're trying to deal with. And I'm not saying that if you don't have any ACEs, you'll be healthy till you're 85 years old and suddenly die in your sleep. I'm just saying that your chances of having more troubles from a physical standpoint go up as your ACE score goes up. Now, back to social issues. Prevalence of ACEs in people who have been homeless for more than 1 month at some time in their life. And the red bars are women with a history of homelessness, which is 2.3% of this survey is like 37,000 people, and women who have not been homeless versus the types of abuse they experience. And what you can see is homelessness is also tied in with adverse childhood experiences. Here's the homeless. Here's the women who experienced homeless. Here's the women who haven't had physical abuse and their homeless rate. Here's the men who have experienced physical abuse and their homeless rate. Emotional abuse, sexual abuse, physical neglect, emotional neglect, any abuse, neglect, any household dysfunction, any childhood adverse event. What you can see is that homelessness, when we see people that are having troubles with homelessness, when we drive down through Salt Lake City or even here locally sometimes, and we see people who are homeless, sometimes, I don't know what you guys think, but I just see an enormous problem. And I think, well, how do we fix this problem? Well, we can spend lots of money and energy and effort to try and get people home, to put roof over their heads, or we can basically, ignore it sometimes, as is what we sometimes do. Sometimes, sometimes we give them bus tickets and send them to Salt Lake City or Ogden. Okay? You think that's funny? That's what we do here in Logan. Okay? I mean, we have some homeless services through Bragg and try to get people with roofs over their heads, but lots of times when somebody is in the behavioral health unit and they don't have a home to go to, when they're discharged from the behavioral health unit, we buy them a bus ticket to the homeless shelter in Ogden. That's what we do. Okay, so sometimes we don't really deal with it here locally. I'm not suggesting what we should or shouldn't do. And I just got the 5-minute warning, so I got to hurry here. This is a slide about the homelessness, the population attributable fractional homelessness, meaning the proportion of all cases of homelessness in the study of 34,000 adults that can be attributed to being exposed to ACEs. And so about 30% of people who are homeless, let's just go to any adverse child event. About 60% of people who have homelessness are on the street. If you go back and look at the ACEs, you can say, okay, probably they're here because of that, not because of a secondary mental illness or a physical problem or something else. They're there because of ACEs. I'm going to sneak over all this stuff. This is prevalence of ACEs in incarcerated females versus non-incarcerated HMO females. It's kind of interesting how how much the ACEs are up in the incarcerated females population. And I can tell you from talking to lots of people in Cache County Jail, this doesn't surprise me a bit. ACEs are associated with early intercourse in teenagers and teen pregnancy and teen paternity, which obviously has its own set of social problems and another generation of ACEs, if you think about it. Anyway, I got to get on here because I got one more slide. I got one more thing I want to show you. The cost is enormous. It's $124 billion per year, $200,000 per individual over the lifetime. And the economic toll is mostly in productivity loss from people not being able to hold down jobs and be productive because of this agitation and anxiety and frustration problems they have in their heads. We spend healthcare, their healthcare costs go up, which is right here. This is the special education costs, this is the child welfare costs, and this is the criminal justice costs. But what you can see here is if we can go upstream and help parents and families be more functional, help them do the best job they can to nurture their children, I think we can cut some of these costs down. I just think we need to focus on this a little bit more. How do children develop resilience? It's already been mentioned. Vaughn mentioned this a little bit, but it's basically it's interactions with adults in their lives. Okay, and we talked about this earlier a little bit, but Esther Lee and I were talking before this meeting, and we came up with this terminology called paleo interactions. We got paleo diets, right? Well, paleo interactions, in my mind, are a very supportive group of people, a community, for lack of a better term, that helps each other out, that interacts with each other. We're not so isolated. When we were growing up 5,000 years ago or 2,000 years ago, even 500 years ago, we had a whole bunch of people under one roof working with each other. And we didn't always get along. Sometimes we had fights, but guess what? We still supported each other, and a child had lots of interactions with adults in their lives. I'm going to show you this little video again from Harvard, and then I'm going to wind up my talk here, because I've only got 1 minute left, I think, right?
Resilience is the result of a highly interactive process between individual characteristics in the person and the environment in which that individual is developed.
It's really the counterbalancing of difficult things that may exist in a child's life with positive things that occur within the family, but even positive things that may exist in the community.
An easy way of thinking about resilience is like a scale with a fulcrum in the middle of it. And there are things on both sides of that scale, experiences of bad things or good things.
Our genes shape where the fulcrum is positioned at the start.
There are certain genes that make a child more sensitive to the effects of maltreatment or parental neglect or witnessing violence.
The fulcrum may start out kind of more towards one side or more towards the other side, and that's going to make a big difference in terms of how much these subsequent events affect things positively or negatively.
Science tells us that experience moves the fulcrum, for better or for worse.
Even though we are born with genes, genes will respond differently to certain environmental situations as opposed to others.
What the genes are actually doing are turning up or turning down the expression of chemicals and circuits in the brain and circuitry in the entire body that govern our responses to stress, to anxiety, to depressive symptoms.
When positive experiences accumulate and children learn coping skills that help them to manage stress, the fulcrum can slide, so the scale tilts toward positive outcomes more easily. That's what resilience is all about.
There's always an adult, or more than one adult, who is key to providing that relationship that helps to build resilience.
So, as we finish up here, I want you to think in your own lives, who was it? Who was it that was your adult or adults in your life that made a difference in your life? Now, this guy right here, unless you live in Sandy, you may not know him, but his name was Malcolm Jeffries. And Malcolm Jeffrey was my scoutmaster when I was 12 years old. I was a total clumsy, klutzy kid. Sports was not part of my genetic makeup, or I didn't get to play enough ball when I was 3 years old. I don't know what happened, but sports was not something I could do very well. But this guy taught me how to fix cars. And all of a sudden I had this belief inside my head that I could actually do something. And he didn't make me feel good about myself. He taught me enough that I could do something and felt good. I basically felt like I was capable. My parents helped me with the same concept by giving me all sorts of opportunities to try stuff out and experience life and support me in whatever I was doing. But this guy right here had an enormous influence on my life. I wouldn't be here. If this guy weren't here, I wouldn't be here. He wrote my letter for recommendation to medical school, but the guy can't hardly write. He barely graduated from high school himself, but he was a cabinet builder, and he wrote a letter of recommendation to medical school that probably had all sorts of grammatical errors and misspelled words and all sorts of stuff, but somehow they read that letter and thought maybe they should accept me. I don't know what happened. But I can tell you right now, this guy had an enormous influence in my life. And I think as community members, we're talking about this paleo interaction stuff. I think we need to reach out in our neighborhoods, in our schools, wherever we are, where we have influence on people, adults who are struggling with raising kids, and kids who are struggling for whatever reason. If we can reach out and try to help them and give them some positive interactions or feedback, to me that helps a lot. I had two other guys. This guy right here is Dallas Jackman. He was my high school biology teacher. But he was much more to me than a high school biology teacher. He taught me genetics and all sorts of other stuff that helped me in my quest to get to medical school. Not that I was planning on that. When I was 10 years old, I was going to be an auto mechanic or a welder. I wasn't going to be a doctor. I wasn't going to do that. But this guy got me interested in biology. We were crossbreeding fruit flies and taking wild fruit flies and crossbreeding with white-eyed fruit flies and different things. We had all sorts of experiments going on there in that school. He was great. This is Reed Walquist, who was my principal at Collinwood High School. What an amazing, calming influence this guy was. He had a vice principal, Mr. Dalton, who would let you have it if you were goofing off. But then he would kind of cover for Mr. Dalton and kind of make everybody else, when you got in trouble, he kind of made you, now, Edward, you need to kind of clean up your act, Ed. Stop goofing off, And so these people had enormous influences in my life. Some people respond to coaches. Some people respond to other people in their lives besides the people that I had in my life outside of my parents. But I can tell you, I would not be here talking to you today were it not for people like this that were in my life when I was a kid. It wouldn't happen. Just telling you. Okay, where do we go from here? We got the rest of the day to talk about this, but I think it's important, number one, to not go down the whole shame pathway. And whatever you do not start pointing fingers, oh, your parents were horrible. Your parents, I always tell my inmates, your parents were doing the best they could. They had some major struggles in their own lives. You go back and ask your mom what was going on in her life when she was a kid, you're going to find out that she suffered from some of the same adverse experiences you had. And most of the time I'm pretty sure I'm right about that. But I would always encourage them to not be angry at their parents, but to understand that their parents did the best job they could. They had some struggles, and now they need to develop some changes in how they cope with things to make their lives better. We need to go upstream, okay? Instead of taking care of people in jails and taking care of people in mental health facilities and hospitals and all that kind of stuff, we need to go upstream and come up with interventions or efforts in the community to try and help parents do the best job they can and help kids who are struggling hopefully before they get to kindergarten. And even after they get to kindergarten, there's still lots of plasticity in that brain that they can still recover. But the earlier onset you get the intervention, the better off they're going to become. So I hope we can go on for the rest of this day and learn about that and take this information back to wherever you're working, whatever you're doing, and help people understand how important this is. This is just really important. Thank you very much.